Hello everyone, how are you guys doing? My name is Fav and thank you for coming to this wonderful new channel. Like I said, my name is Fav, but you all can call me Favu. I'm 35 years old. I live in Ohio. I am married. I am in the medical field, so I am not a nurse or I'm not a doctor, but I do have a lot of knowledge on the medical field and I love it to the core of my body. Medical field is one of the most interesting subject to me. I love it. I can live it, breathe it, I eat it, I strive in it, I love it. It's in my DNA. I live for medicine. So a little back history about me. I am a medical assistant at one of the most biggest hospitals were in my area. Is Level 1 Trauma. It's more of a government hospital, so we cater to people that don't have insurance, the lower income community mostly, because they're the ones that don't have the insurance. We cater to a lot of people that do have a lot of needs that they need. Either could be via social work or could be via public health. It could be by a lot of different things. I'm not saying the other hospitals don't do it, but they do. They do an excellent job. But it's just, this is what I know from the hospital that I do work for. So I am here to give you guys some information on a different aspect of medicine. It could be from asthma, migraines, infertility, endocrine, your cells, the reproduction of a fetus, the sperm counts, your heart, your lungs, your legs, whatever it is that I could come up with plenty of information, not like basic information like, oh, you got a headache, take Tylenol, not that, like, what are the reasons, what it could lead up to whatever's going on. So for example, I have some medical histories of mine are one, I do have asthma, I do have bad allergies, and I do have migraines. So those are the three subjects that I can actually fully go into and talking to you guys that I know from my personal experience. I did experience on infertility problems, so I could definitely give you my personal opinions and medications that I have tried that have worked and that have not worked, so I can give you a better aspect on what you could talk to your provider about. Please take this information with a grain of salt. Don't take this as an advice that you are getting from a medical provider, because I am not a medical provider on whatsoever. My dream is to become a medical provider. I am working towards it, so this actually helps me out on fulfilling that dream of mine. My dream is to become a emergency medicine physician, and leading up to family practice. So medicine, the reason why medicine is so important to me is that without your health, you really don't have anything. You could have all the money in the world, you could have the nicest cars, the nicest jewelry, you could have your trophy wife, your trophy husband, you could have the biggest house, you can have all the everything. But if you don't have your health, you don't have anything. Because the reason why I say that is you could have $1 million, but the problem that you're having in order to help you recover could cost you over $1 million. Do you understand what I'm saying? Like, money does not mean you're healthy. Being skinny does not mean you're healthy. Being heavyweight does not mean you're always a diabetic. Being a smoker does not necessarily always mean you have lung cancer or COPD. It's just, there are so many things, small little things that actually go into every little situation that can make something that is a generic thought of, for example, let's talk about obesity. Just because that person, you think that person eats too much, you think that they are an obese, but that might not be the reason why. So by looking at that person, you need to break down the reasons on why you think they are obese. The first thing you're going to check is the gait. Meaning, I'm not talking about gait as in like a metal gait. When you talk about the gait of a person, it's talking about how that person seems to you when you first see that person. Meaning, how are they walking? How are they looking? How are they talking? How are they sitting? What do they look like to you? When you have a patient walk from one end of the room to the other end of the room, you want to see how their body is shifting. Are they lean? Are they favoring one side of their body more than they are favoring on the other side of the body? Are they holding their back? Are they rubbing on their shoulder? That's something that you have to keep a mental note so that you know to put that in the note so that, well, patients complaining of excessive weight gain. These are the things that I have seen, as in their gait, their walk, their talk, how their body is the body language. The body language tells you a lot more than they can actually verbally tell you, because sometimes some patients don't understand on how to express how they're feeling. So they might say, I can't lose the weight. I've done so much, but I can't lose the weight. Well, a lot of people that don't understand the medical aspect and how the body works, they were like, well, stop eating carbs. It's not just by stop eating carbs. What does your blood work say? How is your thyroid? Do you have polycystic ovarian syndrome? Are you in like basically that blocks some insulin resistant hormones so that you are going to gain weight? You have medications that you're taking that contribute to gaining weight, meaning like sometimes when you are taking a depressant medication for depression can actually make you gain weight. If you are on long terms of steroids, can make you gain weight. Just because the person just sits at home and eat bonbons, that's not only reason why they gain weight. So defining the reasons on why. First is your gait, and then getting the medical history of that patient only, not what the mama, the daddy, the uncle, the auntie, not that, just the patient. After that, then you get the medical history of the immediate family, meaning mom, dad, grandma, grandpa, siblings. Then after that, you go down to see what is going on at home, how to change certain things, if things can be changed by holistically, meaning like if you can change it by changing how they eat, how they do things, how without treating it with a medication, basically like the Eastern medicine. And if that is not working, then you change to the Western Western medicine, meaning like, okay, what can we give you as in like medication wise to help you deal with what's going on? So that's like one thing that I can give you an example of what I will be talking to you about. As you can tell, I am extremely passionate about this. So if you follow me on this channel, which I'm hoping that you have already pressed that subscribe button, I think it's on this side or this side, I can't remember, but make sure you press that subscribe button, make sure you press the like button, and make sure that you press that bell button, because if you don't press that bell button, you will not be notified when I upload a video, or anyone else uploads a video. You're not going to be able to be notified. So since this is a brand spanking new channel, today is the first day of this channel. Today is September 26th, 2018, about 7:30 in the afternoon. So yes, I love this. This is just, my body just gets riled up and gets so just like pumped up when I'm talking about medicine, because that's the base of life. Your health is the base of life. You can have the money, you can have the jewelry, you can have the perfect woman, the perfect man, the perfect children, you can have the quote unquote perfect family, perfect job, whatever. But one thing that is the main important thing of all is your health. If you don't have your health, you can cut everything else off, because what you going to do with all that money? You ain't got your health. You can't spend it. You can't spend your money from a grave. So my point is, come and join me. I'll have plenty of information about different type of medical things that we're talking about. It could be from, like I said, asthma all the way to infertility. Whatever the subject is of that day, I will address at the beginning and then I will continue talking about it. So that's enough for today. So make sure you press that subscribe button, like, share with everybody. If you have any questions on anything that I have talked about today, make sure you leave it in the description box below. I will respond. My email is also there, is favueddy 83 at gmail.com. It's also going to be there. You can check my description, my about part where you can read more about me. So if you have any questions, comments, concerns, make sure you leave in the box below. If there's a subject that you want me to clarify or to talk to you about, please leave in the description box below, and I will try the best of my ability to respond. And if I am lucky enough, I will try to have actually real physicians on my channel to talk about certain things if I am allowed. I'm not sure. I do have to speak with my supervisor to see if she will allow me to actually videotape one-on-one conversation with the physician. I will let you know when that comes up. But until then, thank you very much for coming and subscribing to my channel and helping me grow this wonderful YouTube that we are a part of. So thank you. Bye.